Here's the real talk on Saxenda, brand name for liraglutide. It's the daily GLP-1 for weight loss. If you've wondered, is a daily shot worth it? You're not alone. Let's break down what it does, how much weight you can expect to lose, and how it stacks up against the weekly options. Losing weight and keeping it off is hard because your biology fights back. Hunger hormones rise, metabolism dips. GLP-1 meds work with that biology, not against it. Saxenda is a GLP-1 you inject once a day under the skin, abdomen, thigh, upper arm with a pen. Most people start at 0.6 mg daily and increase weekly to 3.0 millimoles as tolerated. Expect appetite to drop within days, fullness comes faster. In clinical trials with diet and activity, people lost about 5 to 8% of their body weight over a year, more than placebo. That's meaningful for blood sugar, blood pressure, and sleep apnea. But when you stop, weight often returns, so plan for maintenance. Most common side effects: nausea, vomiting, diarrhea, constipation, heartburn, usually worst during dose increases. Slowing the titration, smaller meals, staying hydrated help. Rare but serious: pancreatitis, gallbladder disease. There's a boxed warning about thyroid C-cell tumors. It's not for anyone with personal or family history of medullary thyroid carcinoma or MEN2. Compared to weekly GLP-1s like semaglutide, Wegovy, tirzepatide, Saxenda typically leads to less weight loss and more frequent dosing. Weekly meds average around 12 to 22% in trials. But daily dosing can offer finer control for side effects, may be easier to access in some regions, and some people just feel better on it. If you want a proven, adjustable GLP-1 and don't mind a quick daily shot, Saxenda can work, especially with habits you can keep. If you want bigger, once-weekly results, ask about the newer options. Talk to your clinician about fit, cost, and safety.